Bismillahirrahmanirrahim. I am Dr. Ammad Khan, PGR, MPH, Community Medicine Department. My supervisor is Professor Dr. Saira Afzal. Today, the topic of my presentation is onchocerciasis. Learning outlines, introduction, epidemiology, clinical features, levels of prevention, recent advances, MCQs. Learning outcome. By the end of this presentation, participants will be able to describe global burden, geographical distribution, epidemiological triad, clinical manifestation, diagnosis, prevention, and control of onchocerciasis. Introduction. Onchocerciasis, commonly known as river blindness, is caused by a parasitic worm, Onchocerca vulvus. It is transmitted to human through exposure to repeated bite of infected black flies of the genus Simulium. Symptoms include severe itching, disfiguring skin condition, and visual impairment, including permanent blindness. Problem statement: more than 99% of infected people live in 31 African countries. The disease also exists in some foci in two countries in Latin America and Germany. The global burden of the disease study estimated that in 2017 there were at least 20.9 million people are infected worldwide, of which 14.6 million had skin disease and 1.15 million had vision loss. This is a geographical distribution of onchocerciasis disease. People at risk. Some people most at risk for acquiring onchocerciasis are those who live or work near streams or rivers where there are simulium black flies. Most of the areas where the black flies are found are rural agricultural areas in sub-Saharan African in the countries mentioned previously. Usually, many bites are needed before becoming infected. Therefore, those travelers to at-risk area most likely to become infected are long-term missionaries, peace corps, volunteers, field researchers, and other long-term travelers. Epidemiological triad include agent Onchocerca volvulus, nematode roundworm, environment near stream or rivers where black flies are common, and host is human being. Life cycle, the black fly takes blood meal, passing the larva into human host bloods. The larva migrate to the subcutaneous tissue and undergo two more molds. They form nodules as they mature into the adult worm over 12 to 18 months. After maturing, adult male worms mate with female worms in the subcutaneous tissue to produce between 700 and 1500 microfilariae per day for 10 to 15 years. Microfilaria lifespan 12 to 15 months, detected in the skin 12 to 18 months after the initial infection. The microfilaria migrate to the skin during the day, and the black flies only feed in the day. So the parasite is in a prime position for female fly to ingest it. Black flies take blood meal to ingest these microfilaria to restart the cycle. A simulium female black fly takes a blood meal on an infected human host and ingests microfilaria. The microfilaria enters the gut and thoracic flight muscle of the black fly, progressing into the first larval stage L1. The larva mature into the second larval stage L2 and move to the proboscis and into the saliva in its third larval stage, L3. Maturation takes about 7 days. Adult worms remain in subcutaneous nodules, limiting access to the host immune system. Microflaria, in contrast, are able to induce intense inflammatory response, especially upon the death. Uh, Vulpeccia species have been found to be endosymbiont of O. vulpes adult and microflaria and are thought to be the driving force behind most of the uh, O. vulpes morbidity. Dying microflaria have been recently discovered to release Wolbachia surface protein that activate TLR2 and TLR4, triggering innate immune responses and producing the inflammation and its association morbidity. The severity of illness is directly proportional to the number of infected microflaria to the and the power of the resultant inflammatory response. Disease signs and symptoms. Skin involvement typically consists of intense itching, swelling, and inflammation. A grading system has been developed to categorize the degree of skin involved. Number one is acute papular oncodermatitis, scattered pruritic papules. And second is chronic papular oncodermatitis, large papules resulting in hyperpigmentations. Lichenified oncodermatitis, hyperpigmented papule and plaques with edema, lymphadenopathy, pruritus, common secondary bacterial infection. The fourth one is skin atrophy, loss of elasticity. The skin resemble tissue papers, lizard skin appearance. Fifth is a depigmentation, leopard skin appearance, usually on anterior lower leg, cause thinning of the skin with loss of elasticity that gives the skin a cigarette paper appearance. Contribute to conditions such as hanging crowns. Onchocerciasis eye manifestation. The inflammation caused by larvae that die in the eye result initially in reversible lesion on the cornea that without treatment progress to permanent clouding of the cornea, resulting in blindness. There can also be inflammation of the optic nerve resulting in vision loss, particularly peripheral vision, and eventually blindness. Glaucoma affect eyes malfunction, begin to see shadows or nothing. Diagnosis of onchocerciasis, skin snip biopsy, examination of removed nodule, slit lamp examination, or antibody test. The diagnosis of onchocerciasis can be difficult in light infection, which are more common in person who have traveled to but are not resident of affected area. There are multiple ways that the diagnosis can be made. A skin snip biopsy, gold standard test, 1 to 2 mg shaving or biopsy of skin is done to identify the larva. Seen under a microscope when the shaving or biopsy is put in the physiological solution normal saline, typically 6 snip are taken from different areas of the body. PCR of skin snip can allow for diagnosis if larvae are not visualized. In patient with nodules in the skin, the nodule can be surgically removed and examined for adult worms. Infection in the eye can be diagnosed with a slit lamp examination of the anterior part of the eye where the larva or the lesion they cause are visible. Antibody tests have been developed to test for infection, though they are not widely available. These tests cannot distinguish between past and current infections, so they are not as useful in people who lived in the area where the parasite exists, but they are useful in visitors to these areas. Some of the tests are general tests for infection with any filarial parasite, and some are more specific for onchocerciasis. Treatment for onchocerciasis, drug to kill microfilaria, ivermectin, adult dose is 150 microgram per kg orally in one dose every 6 months. For pediatric dose, 150 mcg per kg orally in one dose every 6 months. To kill microfilaria, doxycycline is recommended 200 mg orally daily for 6 weeks. And in children, peds, the pediatric dose is 200 mg orally daily for 6 weeks. Prevention and control. There are no vaccine or medication available to prevent becoming infected with O. volvulus. This includes wearing insect repellent such as DEET on skin exposure, exposed skin, wearing long sleeves and long pants during the day when black flies bite, and wearing permethrin treated clothes. Mass drug administration, population-based treatment with ivermectin, also known as mass drug administration or MTA, is a current core strategy to eliminate onchocerciasis with the minimum requirement of 80% therapeutic coverage. Onchocerciasis control program between 1974 and 2002, onchocerciasis was brought under control in West Africa through the work of the Onchocerciasis Control Program, using mainly the spray of insecticides against black fly larvae, vector control by helicopter and airplanes, the elimination of human onchocerciasis would make a significant contribution to the attainment of Sustainable Development Goal 3.3, which include a call to end to the epidemic of neglected tropical disease by 2030. In 2016, the expanded special project for the elimination of neglected tropical disease in Africa, ESPEN, was set up to cover the five preventive chemotherapy NTDs with core four objectives. Scale up treatment toward the achievement of 100% geographic coverage, scale down, stopping the treatment once transmission has been interrupted or controlled, achieved, strengthen information system for evidence-based action, and improve the effective use of donated medicine through enhanced supply chain management. SPEN is housed in the WHO Regional Office for Africa. Certifying the elimination of onchocerciasis. Certification of onchocerciasis elimination is the official recognition by WHO of a country's onchocerciasis transmission-free state. By 2016, four countries had been verified by WHO as having interrupted transmission: Colombia, Mexico, Guatemala, Ecuador. Recent update: development of a recombinant vaccine against human onchocerciasis model used to study immunity to onchocerca include natural infection of cattle with Onchocerca okenchi or O. volvulus infective third stage larva implanted within the diffusion chamber in mice. A vaccine comprised of two adjuvant recombinant antigen induced protective immunity in genetically diverse mice, suggesting that it will function similarly in diverse human population. Slash and clear, a community-based vector control method to reduce onchocerciasis transmission by Simulium cerevisiae in Meridi, South Sudan, a prospective study. Biting rate of S. temnosum close to the Meridi Dam spillway decreased by 90% post-slash and clear for more than 6 months. 12 months after the slash and clear intervention, the reduction in biting rate was still at less than 50%. Parity rate reduced from 13% pre-slash and clear to 5.6% post-slash and clear. Larvae collected from the dam were identified as Simulium cerbinum. Conclusion: the slash and clear method was found to be an effective and cheap community-based method to reduce blackfly biting rate caused by S. cerbinum when repeated at least annually together with a high CDT1 coverage. This intervention has been potential to considerably accelerate onchocerciasis elimination. Now it's time for MCQs. MCQ number one. Among many of the infection disease causing the blindness, trachoma is ranked first among the leading infection cause of blindness, second being the chlamydia trachomatis, B is onchocerca volvulus, C is Pseudomonas aeruginosa, or D is Acantha amoeba, and E is Loa loa.
Hmm?
B
B.
is B is the right answer. MCQ number two, onchocerciasis is also called river blindness because option A is people who swim in river got this disease. Option B, vector of river blindness found near river. Option C, it is common in fishermen. Option D, it spreads by consuming freshwater fish. Option E is it spreads by snails.
B.
B.
Yes, B is the right answer. MCQ number three, onchocerciasis causes severe itching, disfiguring skin condition, and visual impairment, including permanent blindness. The mode of transmission of river blindness is option A is bite of black flies, option B fecal oral route, option C contaminated fingers, option D mosquito bite, option E sexual contact.
A.
Yes,
A.
A is the right answer. MCQ number four, onchocerciasis is stated producing microflaria 12 to 18 months after initial infection and can produce up to 1500 microflaria per day for how much duration? Option A 1 to 5 years, option B 5 to 10 years, option C 10 to 15 years, option D 15 to 20 years, option E 20 to 25 years.
Option C.
C is the right.
B.
Yes, C is the right answer. MCQ number 5, the adult form of O. volvulus is mostly confined to the subcutaneous nodule. The black fly ingest microflaria from option A, blood during the night, option B, skin during day, option C, open feces, option D, body tissues not disposed of properly, option E, tears from eye.
A.
A.
B is the right answer. MCQ number 6, dying. microfilariae of O. volvulus have been recently discovered to reveal Wolbachia surface protein that activates TLR2 and TLR4. This bacteria acts as option A endosymbiont of O. volvulus, option B main causative agent of river blindness, option C doxycycline is given to inhibit growth of Wolbachia bacteria. Option D helps in reproductive cycle of parasite. Option E is river blindness morbidity is not reduced related to it.
A.
B.
A is the right answer. MCQ 7 river blindness apart from causing ocular manifestation also have many dermatological manifestation. Which among the following is not related to it? Option A, lizard skin appearance. Option B, leopard skin appearance. Option C, cigarette paper skin appearance. Option D, hanging grounds. Option E is pustular skin appearance.
E.
C.
E, E is the right answer. MCQ number 8, river blindness affects millions of people, of which 14.6 million had skin disease and 1.15 million had vision loss. The gold standard test for river blindness is option A skin snip biopsy for larva, option B excisional biopsy for skin nodule for adult parasites, option C antibody test, option D slit lamp examination of cornea, option E is examination of blood smear for the presence of larva.
E.
A.
A is the right
B.
answer. Option A is the right answer. Skin snip biopsy is the gold standard for onchocerciasis diagnosis. For MCQ number 9, for the relief of symptoms caused by river blindness, ivermectin is given 150 mcg per kg to adults to kill microfilariae in a single dose every 6 months for how much time? Option A 1 to 5 years, option B 5 to 10 years, option C 10 to 15 years, option D 15 to 20 years, and option E is 20 to 25 years.
B.
C is the right answer, 10 to 15 years. MCQ number 10, for the prevention and control of river blindness, different strategies are being used. Which of the following is no more suitable now? Option A, mass drug administration of ivermectin. Option B, wearing long sleeves and pants. Wearing permethrin treated cloths. Or D is applying DEET on exposed skin. Option E is insecticidal spray by aeroplanes.
C.
No,
E.
it's E is the right answer.
E.
This is the key of all the MCQs. These are the references through which this presentation has been made. Here is the link of YouTube channel of this presentation is there. Thank you so much.
Thank you very much, Dr. Ammad. Very nice presentation. As we know that still there are many people who are getting infection by onchocerciasis, which is also known as river blindness. There is also very important part that you have presented, that after the discovery of ivermectin, million and million lives have been saved, and the quality of life in these patients have been increased. However, you are well aware of this fact that this infection is more near the fast flowing streams and rivers. That is why it is also called river blindness. And in the remote rural villages where the hygienic practices are not there. So this is the dilemma, that the rivers are there, the fast flowing streams are there, but still the hand hygiene practices and other hygiene measures are not being observed by the people. As it leads to permanent skin damage as well as blindness. So the treatment is necessary, and there is a very important drug that is ivermectin, and ivermectin has won the Nobel Prize because of its discovery and saving millions of lives. However, in later stages, as we know that it may lead to eye surgery and glaucoma surgery, or if there is any cataract, then cataract surgery is required to restore vision and to cure the blindness. So prevention is better than cure, and the cure is again a dependent on the medical as well as surgical treatments. And the recent advances are again on onchocerciasis, especially towards the diagnostic part. And Dr. Ammad, you have presented it very nicely. So thank you very much, everyone, for today's class. So see you in the department. Allah Hafiz.
Allah Hafiz, ma'am.
Yeah, please, ma'am.